Welcome to a new edition of the Famous Interviews with Joe Dimino. On this episode, we talk with licensed clinical psychologist Dr. Hayden Finch. Along with being a psychologist, she is a behavior change expert and author. She is the CEO and founder of the Finch Center for High Functioning Anxiety and the author of 2 books on procrastination and habits. Her mission is to equip people with the skills to master anxiety, discover self-acceptance, and find meaning in a busy life. She originally hails from coastal North Carolina and is a go-getter with a passion for translating research into usable strategies, empowering others to be true to themselves, and dedicating herself to learning and personal growth. She's a great interview. Enjoy.
Great to meet you. Thank you for taking a minute out. And before we get into your life and your work and how it's made you who you are, I want to know, the last 3 years we've gone through quite a thing with COVID, and it's affected everybody in different ways. So my question to you is, how did you survive that time period, and how has it changed the way that you look at life and conduct business now?
Yeah, it's been wild because, not only was it the pandemic, and so it sort of affected everybody, but I also got pregnant at the beginning of the pandemic, right? And so my life changed wildly, and we moved from Iowa to Arkansas. So my personal life was changing anyways, but on top of that, we had this major change socially and globally, and I'm a psychologist, so there was a big change in people's mental health needs, and we all switched to telehealth. So there's just like a wild change for me personally and professionally, and becoming just a totally different person. And so, yeah, it's been kind of a wild thing, and I think for me, it's been a lot of figuring out how to pivot, and so taking my life and figuring out what's working about it and what's no longer working, and then figuring out some systems to pivot, right, to make it work differently. And that's what I work with all of my clients on too, is, taking life. So in the beginning of the pandemic, life looks really different. Your kids are at home with you now, or you're working from home. Life looks really different. We got to figure out what's working about it and what's not, and pivot there so that, we can continue to function pretty well. We got to use your strengths and the skills that you've got in a different way.
So the spotlight was really put on mental health. I think since COVID, it's been brought out in a way where it's a little bit more of a norm instead of being seen as something that's kind of, alien. So your business is probably spiked, and do you feel like you're conducting, clinically speaking, things differently now than you were pre-pandemic?
For sure. I mean, some of it just logistically is very different. I'm 100% telehealth now, whereas before I was 100% in the office. And for a while, the conversations I was having with people were very different. It was a lot of health anxiety, which was new, and it was a lot of just the uncertainty of what we were going through. And that has settled down now, where now it's kind of back in general to the conversations that I was having previously with people. But I think people are more aware now of just how difficult it is to tolerate uncertainty and how central that is to being able to just function normally.
So my son's on the autism spectrum. He's 18, and we've done telehealth appointments since the pandemic began. And I find that to be one of the greatest parts of this entire process, because it was it took so much out of us to go get him out of school, drive, say, 20, 30 minutes downtown, go to the appointment. They only need to see him for 5, me for the rest. I'm keeping an eye on him while I'm trying to focus. But now, with these remote sessions, it's so much easier. Are you noticing that?
Yeah, no, it's great too, because I can see people in their real environment, right? They're in their homes, and so in some ways they're more comfortable there because they're in their own space. They don't have to dress up. They don't have to get stress about traffic and being punctual and all of that. So they can come into the session a little bit easier. But also because we're in their home, it's easier for them to access some of the things they need to access, emotionally, right? Because they're in a place that is safe for them. They can access things emotionally that they can't in some stranger's office. But also when I'm treating things like OCD, right? We can do treatment in your home, right? If you're afraid of using knives in your own home or touching doorknobs in your own home or afraid of contaminating your own home. Like, this is great. Like, because now, like, I'm showing up inside your house and we can do treatment there. So yeah, I really love it because, it seems to be a great fit for a lot of people. Not everyone. Some people still prefer the office, but for a lot of people, it's really been great.
Yeah, it's been one of those silver linings of this process for as much as it's been taxing and uncertain and harrowing in a lot of ways. I think there's been a lot of good things that have come out of it. So let's break down the way you go about your business and what you do exactly. And I'm going to put you in front of a bunch of third graders at a career day. One of the kids looks up at you and says, "What is it that you do for a living?" How do you answer that child?
Well, I would tell children, when you go to the doctor, they help you keep your body well. They can help you stay healthy, and they help you heal when you're hurt. And I do the same thing, but for people's feelings. So when their feelings are hurt, I help heal them, and I help keep them well emotionally. So that's what I tell children. Like, I'm your feelings doctor, not your body doctor.
So let's say hypothetically that you're in the third grade and somebody's there from career day and they ask you, "What do you want to be when you grow up?" How do you answer them?
Oh, goodness. Yeah, that's tricky. I would say that I want to be a place where people feel safe to talk about the hard stuff. I remember when I was in fourth grade, that's what I would do on the playground, was like talk to people about, the things that were worrying them, which like little fourth grade problems. But that's still what I'm doing now, is like being a safe place for people to talk about the hard stuff and to heal from it.
So let's go back to your childhood. Tell me a little bit about where you were born and raised, and kind of explain some of these seeds that were planted in you to become who you are, to give as much as you do, to help people, to be in that capacity, to want to help other people.
Yeah, I was born and raised in eastern North Carolina near the Outer Banks. Pretty quiet, seasonal place. We're very busy in the summer, but really kind of deserted in the winter sort of place. And I was raised in a pretty high-achieving school system and family, and there was a lot of pressure to perform academically. And that kind of messed me up, right? Like, it was really helpful in a lot of ways because I did achieve a lot, and it kind of messed me up. And so it was when I got to college and I was looking around me at everyone else who had come from all of these different places and were thinking about the world differently than I had in my little echo chamber of the world, that I really came to realize that I wasn't thinking about things in the healthiest way, and I wasn't behaving in the healthiest way. I was very successful objectively, but I was pretty miserable with it. And so that's what got me on the path to thinking, what went wrong here and how can I fix it? Because I needed to do that personally, but along my way to figuring it out personally, I realized that there are a lot of other people, especially high-achieving people, that are in the same boat, where there was so much pressure that sort of obscured everything else that matters in life. I knew that I was off track and wasn't living the life I wanted to be. And I realized as I've become a clinician that there are lots of other people, too, that are very successful, but they aren't happy. They're not living the life they want to be living. And so it's been figuring out, the systems of things that were working for me, because, of course, I still want to be successful. And so figuring out what's working for me and where it went awry so that it's no longer working for me.
The other big part of our lives that really kind of fuels who we become and who we are, those that we look up to. Who's been a role model or a hero for you in your life?
Well, certainly my parents, right? Like, they certainly are. They definitely gave me a lot of the tools I needed to be successful. They were really strong about industriousness and work ethic. And also, my grad school advisor was instrumental, because I did my grad studies at Nebraska, and when I went there for my interview, I came away with my mind blown, because that was the first time I'd really been around a group of people that were highly successful and super well adjusted. I hadn't seen that any other time in my life, and my mind was blown. And he was instrumental for me in helping me understand how you can be both how you can be successful and keep the skills that I had, been practicing all my life up until that point, but also be well adjusted, like where to pull back and where to kind of lean into some flexibility. And so his name is Will Spalding, instrumental, huge guy in the schizophrenia research world, very well known there, and really instrumental in my life for figuring out that balance between success and flexibility.
So speaking of that, you have to give a lot to your clients. And how do you balance that? How do you give what you need to give as a professional, as someone that wants to help people, but keep that back to help you and to keep your life going in a healthy way?
It's really about boundary setting, right? Everybody has to do that with your job to keep it from taking over your life. And that's what we do in mental health too. It's a little bit trickier though, because, it's not as simple as just closing a laptop. I get invested in these people's lives, and I genuinely care about, these people and the problems that they're having and the struggles that they've been through. And so it does take a little bit of work to set some boundaries and really to separate my life from their lives. And it's really tricky, and that's why we go to school so long, is to figure that out, about how to genuinely care about someone and be invested in them, and also to be able to keep some distance between that person and what they're going through versus me and what I'm going through.
So I'm going to kind of go back to the question about, your hero and role model and ask you this. If you could meet anybody alive on the planet right now and spend some time with them, who would it be?
Oh, gosh, alive. I know it's always been alive or dead, and I feel like a lot of my choices are unfortunately dead now. Alive. I want to be thoughtful about this because I don't have it on the tip of my tongue. Honestly, I know it's going to sound like a cop-out, but honestly, I feel like I didn't get enough time with Will Spalding in Nebraska. Like, I wish I could, now that I'm older and see the world differently than I even did in grad school, I wish I could go back and spend more time with him and learn more from him, because the way he sees the world is so incredible. And I know that's not going to relate to your audience because they don't know this guy. But for me, like, that's the honest answer, is I have so much more to learn from him about psychology and about life. I'd have to think more, though, about somebody that people could generally relate to.
No, that's great. That definitely taps into who you are. So, every day we get up, we have all these things that we want to do, lists and goals and dreams. But what is it ultimately that fuels you through the day, that gets you motivated and gets you to go through that day?
This is the shift I've made in my life, right? I am constantly coming back to my values. When I don't keep that in check, then I sort of default toward working more, earning more money, achieving more, getting sort of those accolades and just achievements. And I have to constantly keep that in check for myself and ask myself, what is my priority? Because by definition, there can only be one priority. And so for right now in my life, I have a toddler. So my priority is being a mom and raising a toddler and having a family. And so when I'm staying motivated in life, it all comes back to that. How can I be healthy so that I show up as a good mom? How can I work hard so that I can support my family financially? How can I, at the end of the day, still have enough emotional energy left over to invest in my family? But everything comes back to being motivated to have a really strong family right now. So for me, it's about getting really clear on my values, and that's going to shift over time. But right now in this season of my life, it's all about family. So every decision I make is about pushing in that direction.
So let's get to the end of that proverbial day. How do you quantify a good day? How do you say that day worked for me?
I always look at, I try to be well-rounded in my life. There have been seasons of my life when it was a singular focus, but right now I'm trying to be well-rounded. So a good day for me looks like I took care of myself physically. So that means I exercised or moved my body in some way. I ate decently good food. I slept enough. So 8.5 hours is a must for me. So I took care of myself physically. I worked hard. So when I'm at my office, I am working hard that whole time. And I had enough emotional energy left over. So I didn't spend it all in places that mattered less. I had emotional energy left over at the end of the day. I don't want to be crashing into my bed at night. That means that I did something wrong probably that day. I want to, at the end of the day, feel still like I have a little bit of energy left over.
Let's say you have a dream tonight. You run into the 20-year-old version of yourself, and you could give that younger version of you a piece of advice based on the wisdom you've gained, the roads you've gone down, the things that you've overcome. What would you tell your young version?
I would tell myself to slow down. When I was younger, I was trying to do everything as big as possible and as fast as possible. I was trying to get to the finish line as quickly as possible. And now that I'm older, I realize, first of all, there is no finish line. Like the whole point of it is just to continue this journey. And I would tell myself to take my time, to slow down, to learn more, to listen more, to pay attention more, to experience more, because that's the whole point of being here, is to just experience it.
So what are you the proudest of you've done in your life so far? What is it that you look back and say that's the moment?
Oh, that's tough. I am really proud of what I've accomplished professionally. I'm in a totally 180 from what I imagined I would be doing. And that took a lot of courage, first of all, to do that. But it also took a lot of skill development at the things that I'm not naturally great at. I am naturally great at getting on a path and sticking to it and doing it 100%. And so to be able to take a different path and to know when to take a turn or take a different fork in the road, that took a lot of skill development for me. And so I'm really proud of myself that I've been able to do that repeatedly in my life so far. And I'm still pretty young, right? I'm only in my 30s, but I'm really proud that I'm able to do that now, and I'm optimistic that I can continue to do that so that at the end of my life, hopefully, I've taken the detours that were really important for me.
So as we enter this post-pandemic phase of our existence here, especially in America with everything that we've gone through, what would be your advice for all of us that whether we acknowledge it or not, we're going through PTSD for what we lived through? What would be your advice for everyone to help themselves kind of soothe and to maybe get stronger and persevere as we move forward?
Well, obviously, I feel like most people should be working with a therapist. That's no surprise. But outside of that, I do think it's about getting really clear on what matters to us, finding some meaning and some purpose for our lives is critical. And for some people, that's really easy. It just comes really naturally to know what you're here for and what you're doing. And for other people, that actually creates some anxiety to think about that and to think about questions that deep and that big. But I think when you have a clear purpose, that makes a lot of things easier to deal with, and it makes your decisions easier to make.
So in our lives, we have all these different groups of people that we interact with, whether it's family, friends, colleagues, clients. But ultimately, we're the ones that are in charge of our, ego, superego, so to speak. What's your perception of you? Who do you think you are?
Currently, I'm going to be honest with you. I feel personally sometimes a little bit lost. And I don't know exactly who I am. And that's a pretty typical crisis for your 30s, is to be whoa, what am I doing here? And am I on the right path? And so sometimes I do feel a little bit lost. I'm optimistic and hopeful that I will figure that out. But there are other times where I feel like I know myself really well, and I'm a person who is dedicated to my goals and who works hard and perseveres. And that's really the life I live most of the time. But sometimes when I do slow down and think deeper, I'm wait a second. I sometimes feel a little bit lost. And I think, that's, like I said, that's a normal part of development that we kind of go through periodically. And right now, that's probably part of it, is figuring out who am I really, beyond just the what do I do. That the who am I is a little bit deeper, and I'm trying to figure that out right now.
So Hayden, if anyone out there wants to learn more about you, hire you, anything revolving around your world, where's the best place for them to go?
Everything about me is at haydenfinch.com. That's the best place to find out, what I'm up to. So I run a clinic where I treat people with high-functioning anxiety. I've written a couple of books, lots of mental health resources there, but definitely links to to contact me for people who want more information about me.
Hayden, thank you for your story. Thank you for your work. I appreciate you being open and revealing. And good luck with everything as we move forward. I appreciate it.
Really appreciate your time.
Thanks for tuning in to another famous interview with Joe Dimino, where we cover the world of art, literature, business, spirituality, therapy, and more from around the globe. If you want to hear more interviews, visit the Famous Interviews with Joe Dimino channel on YouTube. Find us on Spotify and Apple Podcasts. Thanks again for listening, and until next time.